Hi everyone, it's Hiba from Wiser Humans, and I am here with Jonathan Shubs, who's an acupuncturist and acupuncture teacher, teaching and working in Lausanne and also worldwide. And I'm here with him today because I am doing this series around different points of views, different perspectives on this pandemic that's happening right now. And today I'm looking forward to hearing from Jonathan about the Chinese medicine and philosophy perspective on this pandemic and how to work with it in a maybe different way from our more familiar Western approaches. So thank you, Jonathan, for joining.
Oh, my pleasure.
So what would you say, just your point of view, your perspective is on what's happening right now?
Well, there's a couple of different things to look at. We can look at from society, from the social aspect, from the economic aspect, and from the health aspect. In general, I would say what's happening now from like the Chinese Taoist point of view, more of like the society philosophical aspect, is talking about there's a moment of change in the world.
Mm-hmm.
And we either have a choice to either accept the change, not to accept to accept the consequences. It doesn't mean that we can't choose how we move forward, but the present moment is about just accepting what's happening now and then deciding what's the best way for us to move forward individually, as a group, as a society, etc. So that's the first thing, is that there's that focus on first coming to terms with what's happening,
Mm-hmm.
which I've noticed a lot of people are very much in resistance to. It's getting better this last week, but at the beginning there was a lot of resistance to when do we go back to normal? And the acceptance is there is no normal. Everything is constantly changing, and it's just to accept that.
Mm-hmm.
There was a great talk by, well, this isn't Chinese medicine, but it's by Gabor Mate, who we both
Yes.
appreciate very much. And he was talking in relation to addiction, but it's also to, let's say, our addiction to our normal life. There was a Buddhist monk who was speaking, and they asked him, how would you talk about addiction? He said, well, the main difference between the Eastern approach and the Western approach to thinking about it is, in the Western approach, there's this idea of, oh no, it is chaos. This is horrible. And then the Eastern approach would be, this is chaos. I can't control anything. How lucky am I?
Because in a way I'm forced to let go and not even try to control things.
Exactly. As long as you lose the complete illusion of control, you're free from it.
Yes.
Right? You've
Yeah.
surrendered your need for control. And that is a huge moving forward step in being able to accept the situation.
Yes. And
Yeah.
you're saying also that you're noticing that the more we go on with this situation, the more acceptance there is, because
Yes.
we realize that we
Yeah.
can't actually change what's happening on an individual level.
Mm-hmm. Exactly. I think we always have this idea that we can influence the world to make it the way we want it.
Mm-hmm.
And here we're being confronted with, you can't. Change is constantly happening. Instead of us holding on to our past ways of doing things, we're having to tune into, we can adapt. As soon as you accept the situation, then you can say, okay, how do I respond to it?
Yes.
And that's a big change in the way that we can perceive things. And I think everybody's going through that at a different level and on different parts of what they're doing.
Yeah. And I feel like we're also learning in quite a powerful way just how adaptable we are as a species. How, in a strange way, this has been going on for a lot of us for about a month now that we've been in this confinement, and it is starting to feel quite natural in a way. And it's strange how quickly we've adapted to that after that initial kind of protest
Exactly.
denial phase.
Mm-hmm. Yeah, so that's one of the things that I think. And then we can still see that, like with the way that the governments are thinking about economy, is when do we get back to normal? But shouldn't be a normal. We should constantly be adapting and interacting with the environment instead of imposing our perception of what it should be,
Yes.
right? So move
Yeah.
away from idealism and move into pragmatism.
And is this from the Taoist perspective that you mentioned before?
Yes, the Taoism is probably, it's the most traditional or oldest Chinese philosophy. And a lot of it is about accepting the situation as it is. And instead of imposing your will for something to happen, is that you get in tune, or you get centered in what is happening, and then your actions are in alignment with the situation, as opposed to trying to force the situation. So there's a term called wu wei, which it's often translated as action without action.
Okay.
And it's actually not very true. It's action without the intent of change. It's action with being with what's happening. So you're actually going with the flow. Like, that's the easy way to talk about it, right?
Okay.
Going with the flow and accepting the situation, and then your actions come naturally instead of you imposing what you want to happen.
Sounds almost like a action that comes from a real place of acceptance.
Exactly.
Instead of using more this sense of will or like needing to control things.
Right. Exactly. There's a very good analogy is a sailing ship. Now, when you have a sailing ship, you have the wind. You don't have a choice as to how the wind is going to blow. So you can either fight the wind, and you won't get where you're going. It'll be very difficult. Or you can go with the wind, and instead of going in a straight line, you might be going in a zigzag line because you have to go with the wind to use it properly. But you'll still get where you're going. You'll be using less energy because you're not fighting anything. You're using what's there to help you move forward.
Okay. Yeah.
So, yeah, that's
Makes a
the
lot of sense.
Taoist.
Can you say that word again? Wu Wei?
Wu Wei. Yeah. Wu Wei.
Okay. Yeah.
And it's one of the cornerstones of the Taoist philosophy. And we're seeing that it's one of the easiest, it's the most, for me, it's the most holistic or deepest way in which to respond to these types of situations.
And I think something that we are being called to practice very much right now.
I would agree.
Yes.
Yeah.
Okay.
Mm-hmm. And then there was the question of the health, right? Or how people can respond to this with their health. So as probably a lot of people know, is the Chinese medicine point of view is that we start not when we get ill, but we start from a prevention point of view. And prevention is also this idea of wu wei. It's not this idea of this is what's coming at me, I have to build up all my defenses. This is what's coming. What resources do I have? How can I reinforce my resources to better interact with it? It's not a war with the external world, right?
Okay.
It's more of a what can I do to help me respond best, not help me to defend or attack. That's not the point of what we're doing with Chinese medicine. It's not to get rid of something. It's to how to interact with it with the best abilities I have. So from the what we would call prevention in the West, what we would be looking at is building up the internal resources of the patient. In Western medicine, we might call it the immune system. But to not look at the immune system as these warriors that are going to defend us, if you want to take the idea of how countries interact, the idea of war is the last resort. First, you have all the diplomatic and the economic and all these different interactions before you decide to go to war. You only go to war as your last resort. So from immunity point of view, it shouldn't be about how do we attack the virus. It should be, first of all, how can we build our bodies to better interact with the virus?
Okay. And by
Um,
interact, do you have a metaphor for that? So it's not a war. What
right.
is it instead?
So it's a relationship,
Okay.
right? So in a relationship, you can have war. You can be very combative. And as we all know, in most of our relationships, those are relationships that take a lot of energy and they don't last very long, right? At the end, that relationship breaks.
Hmm.
Either one side wins or the other side wins, or they both lose.
Yes.
Those are the only three possible outcomes from a real war.
Hmm.
Whereas also within a relationship, there can be this idea of give and take, right? So it's not this idea of you're not going to get the virus. It's how can I build up my energy? How can I build up my body? So when the virus does come, it might take a little bit, but it's not going. I'm not going to. It's not going to take as everything.
Okay. Because I will
Right?
have the resources that I've already built and strengthened in myself to be in dialogue in a way with this virus.
Exactly. So sometimes in a relationship, you know that the other party they have one thing that they really, really need, right?
Hmm.
But they have other things that aren't so important to them. So if you can build up that one thing that they really, really need and you have enough to give it to them, the rest of the stuff is not going to be a problem. That's
Okay.
all they need. So if you look at the virus at the moment, what it really needs is oxygen,
Hmm.
right? When we're looking at how, especially recently within the last week or so, they've been looking at different protocols and they're seeing that the the best analogy we have to how the virus affects the body is altitude sickness. It's like somebody who's at the top of Mount Everest and hasn't had time to get used to it,
Okay.
right? And how do you get used to that? Is well, you start building up oxygen in the body. That's what the person, when they climb up the mountain slowly, they start to learn and their body learns how to work with oxygen and to get all the oxygen so they can continue doing it. So right now, from a preventative point of view, our best thing to do is to build up our oxygen intake.
Oh,
So things that help us to build up oxygen. Now, so people who like to go and do exercise, that's why exercise is going to be useful. It's going to help build up your ability to get oxygen into your body.
okay.
Um, Also, from the Chinese medicine point of view, we do a lot of qigong, which is a series of movements that we can do to help build up oxygen in the body, and other things also.
Is there also, are there also like breathing techniques and yoga and,
Of
um,
course.
all those practices that can also help, in a way, helping your lungs to adapt to this situation and to prepare in a way?
Mm-hmm. Yeah, so any type of breathing technique, meditation, because meditation is also very much working on breath, yoga. I come from the Chinese point of view, so we would use more qigong.
Hmm.
And qigong can also be more therapeutic, in is that we can direct it specifically to the patient or the person, whereas often with yoga, it's a series of movements that are set for that
Yes.
type of yoga. Unless you work, there are some yoga practitioners who really do personalized based, they mix the Ayurvedic medicine with the yoga, which is which is more similar to what Qigong would be.
Hmm. So you're saying
So,
that from your perspective, it always needs to be quite personalized.
well, yes, that's one of the cornerstones of acupuncture, of Chinese medicine, most holistic medicines, is that we don't treat the symptom as we treat the patient.
Hmm.
So we treat, just to move away from what we have right now with COVID. But if I see somebody with a headache, I don't treat the headache. I treat the patient who has the headache,
Yes.
right?
Yeah.
And so my treatment for that headache will be different for that patient to another patient who has a very similar headache as a symptom, but
Hmm.
everything else can be different.
Yeah.
And so it's that personalized medicine is, and we're also seeing that more and more now in Western medicines. That's what they're trying to understand, is how to personalize medicine for each person. Um, at the moment, there's some restrictions on that. For example, well, within the psychology area, when they give antidepressant medicines, they always have to find the right balance for that patient, right? So they're starting to, but it's still very specific to the medication, but they have to balance it to that person. So even though they might have 3 patients with panic attacks, they'd each get a different antidepressant, and they might each also get a different dosage of that antidepressant, depending on the person, for it to be most effective.
Yeah.
So yeah, it's that personalization that really makes the difference between medicine that can help us, or otherwise that's why some treatments only get maybe a 50-60% success rate, even though in the lab they work perfectly. Is because only 50-60%, that's the actual dosage and the medication that they need.
Yes. Yeah. I was thinking also when you were talking about how this affects the oxygen intake, and I imagine that's related to the lungs.
It's related to the lungs, and it's also related to the blood supply in the heart, because the heart is what moves the blood, the oxygenated blood, all through the body.
Okay. And I'm wondering from a Chinese medicine perspective, what are these systems, what emotion are these systems associated with?
Okay, so the way that we look at this type of attack or this type of interaction with the environment, we would look at it at different levels, and it depends at which level the person is interacting with it at, as to which emotion would be behind it. And we'd be looking at a mixture of emotions. We wouldn't just be looking at one emotion. So often the very first attack, right, when the person would first get it, we would be looking at a mixture. We would be looking at from the 5-element point of view, which I can get into another time, we'd be looking at the metal and water interactions. So we'd be looking at the emotions of fear and sadness together.
Okay.
So it would be a fear and sadness relationship. And as it goes down, we would then have maybe sadness and the ability to interact with our environment, which in Chinese medicine is considered an emotion.
The ability to interact with our environment.
It's this idea that you have a central position. The way that we look at it is that the emotions are the body's response to the environment, either internal or external. So that emotion needs to be centralized and then understood by the body. And it's that centralizing and understanding of the body of what the emotion is and how to respond to it that we put in that element of earth.
Okay.
Which is intention and being able to be imaginative and being grounded. So it is an emotion in the Chinese medicine point of view. I know it's not necessarily in the psychology point of view, but it's that central pivot that all the other emotions need to access for the body and for the mind and the spirit to respond properly.
Okay. Yeah, it's interesting because those are also maybe what some of the emotions that are coming up right now, even if we haven't had the virus personally, but just what's coming up on a global, I think on a collective level is a lot, fear and sadness and grief.
Yes.
And maybe this emotion that you're describing about our position with the world, I think that's very much being questioned, and we're asking ourselves some really important questions, I think, about that.
Yeah.
Yeah.
And then it can also go deeper. And when it gets deeper, then we get into like a relationship of anger. The deeper it gets, because then we get into this, anger is the defense mechanism. It's the protection. And as the illness goes deeper into the body, then we need to, then the body goes into this very strong protection mode. Right? So we get the protection area, we get the protection coming out. And also, then if it gets very deep, then it would be the relationship between protection or anger and fear comes back. So that would be the progression that we would be looking at from an emotional point of view.
So fascinating to me how an approach like traditional Chinese medicine, which has been around for so long. I don't even know how long. What is it? 2,000 years,
We can
4,000
say
years?
that we have documentation that says, like, giving things from 2,500 years ago, and it's probably much longer than that because it was an oral tradition before.
Hmm. But just how interlinked, the physical body and emotions are, and that seems so normal and obvious, I think, in this approach. And I think
Yes.
that how we've separated that in our Western approach, when they are completely interlinked, in my point of view as well.
Yeah, no, I
Yeah.
agree with you, and that's one of the reasons why I'm passionate about it, is because it has that holistic, complete approach to not just the human body, but the human mind, the human spirit, and everything.
Hmm. Do you
Yeah.
have any advice or any tips to share about how to deal with what's happening right now?
Hmm. Well, one of the things that I would, from more of like a preventative point of view, is we were talking about bringing up oxygen.
Mm-hmm.
So for China, from a Chinese, let's say, medicine point of view, some of the things that we can do to help our body absorb more oxygen from around us, two of the main ingredients that we can use, like in cooking or if you're going to make teas, would be a ginger and carrot tea.
Oh.
Ginger and carrots together carrots are very good for the lungs and the absorption of oxygen
Mm-hmm.
from a Chinese medicine point of view. And the ginger helps move the blood, which would help oxygenate the rest of the body.
Okay.
So ginger tea with, you can put just slice some carrots in it, and you cook the carrots and the ginger, and you can drink that. That's going to be very good at the moment.
Mm-hmm.
And then also the whole idea of the antioxidant movement in the West would be very useful. So to have high antioxidant, foods and drinks, etc.
Like what?
Well, if you live in Europe, red wine, but not too much. um, green vegetables, lots of, anything that's pretty much green, unless it's done with with food coloring, is going to be very good for you. Also fruits, what are some of the aca fruit or grenadine fruit, pomegranate, all of these high antioxidant foods that we have.
Mm-hmm. Green tea.
Green tea, for example, or mate, or I guess cold brew coffee would also fall into that in some ways.
Yeah, coffee is quite high in antioxidants as well.
It is, yeah.
Yeah.
One of the things that we would also suggest is to stay away from cold beverages.
Okay.
Right? Because that actually makes the body function, think about it as if you have a bunch of tubes running through your body moving liquid. If it's cold, it's going to be much slower than if it's warm.
Okay. So more sort of
Right? More teas,
warm water as
tisanes.
well, like not ice
Yeah,
cold water.
exactly.
Okay.
That would be, also with foods, is to try to eat more warm foods, because although cold foods and raw foods have more nutrients in them, it also takes a lot more energy for the body to extract those nutrients.
Mm-hmm.
So, soups or long cooked stews or things where you put everything in, you cook it for a long time, and then you also eat the cooking liquid that you ate it with, you're going to get all the nutrients. That's going to be much easier for the body to digest it.
Okay.
And
Yeah.
this way we're conserving our energy,
Yes.
right? That's the idea is in Chinese medicine. It's only when it's, in the middle of the summer in July and June that we eat the cold vegetables, because that's when there's so much energy abundant from the sun, is that we can digest it easier.
Mm-hmm. So
Right?
we're trying to conserve some of that energy at this time where we might need to
Exactly.
as much of
To
our own
respond better.
resources as possible.
Exactly.
Yeah.
Exactly. So yeah, from a diet point of view, there's that. And then there's also, as you're very well aware of, is the more we dwell on emotions, the more that we hold on to emotions, the more acidity and the more difficult it is in the body. So to be very conscious of working through your emotions and allowing them to come, but then not holding on to them and allowing them
Mm.
to leave also.
Yes.
And there's many techniques for that. There's therapy, there's just meditation. For some people, it's exercise. And then you can, but that's
Yeah.
also a very important point, is to take this time to really, and we have the time now to say, oh, I don't have the time to deal with it. We all have
Yes.
the time now. So it's the moment to
Yeah.
do it.
I mean, it's interesting because in a way, it goes back to what you were saying about exercise and how moving our bodies allows the body to get more oxygen.
Hmm.
Emotions, the word actually comes from emotion, comes from
Yeah.
the word to move in Latin, and
Hmm.
it's actually about allowing this energy that comes with emotions to move through us. And by doing that, it's almost like you're allowing more space, you're allowing more room in your body instead of them staying stuck and festering and getting bigger when we kind of resist them or don't want to feel them. So
Exactly.
so it's kind of interesting
Yeah.
to see it almost like you're, yeah, oxygenating your body by allowing the flow of emotions and not staying
Hmm.
stuck on any of the emotions, and recognizing
Exactly.
that it's okay to feel what we're feeling.
Yeah. There's that comes back to that idea at the beginning. The Wu Wei is, you're feeling what you're feeling. That's not something to fight against.
Yes. Yeah.
The idea is okay, I'm feeling what I'm feeling. Let me feel it. Let me move through it. That's there. You're moving with the flow of your emotions. You're not resisting them.
Yeah. Yeah. I always think of it as like feeling it fully, and then I can let it go.
Yes.
So even to go a little bit more into it so that it can be released.
Hmm. Yeah.
Yeah.
There's many analogies and metaphors that we can use for it, but they all come back to the same,
Yes.
that same principle.
Yeah.
So yeah.
Okay.
And the way that I'm helping my patients now is, well, some of them are doing, most of them are doing okay. And then the ones that need to, I'm doing online sessions where I can show some very personalized qigong for them, and maybe some acupressure points, but it's always specific to the patient. I don't just give a general, this is what everybody does.
Yes, because of the importance of taking the whole person into account and not just the symptom.
Exactly.
Yeah.
Exactly.
Can you
Yeah.
tell us just a little bit about how acupressure actually works?
Okay, so acupressure or acupuncture, if you came into the clinic, would be acupuncture. Here I would be saying acupressure. The body is, in Chinese medicine, we look at the body as having what we call meridians. And when we look at meridians, they're actually these vertical segments of the body. And each segment of the body will have slightly different effects on the internal aspects of the body based on how much sun it gets, where it is in the body, etc. And the whole idea of acupressure or acupuncture is about information. So how can we um, give or signal information for the body that it says, oh, okay, I can interact differently.
Mhm.
So when we look at acupressure points or acupuncture points, we're looking at what information is the body sort of forgotten, because the body knows how to heal itself,
Mhm.
right? Just like with everything. However, we get into a routine where the body often forgets, or it says, okay, I'm going to do this because at the moment that was better, and it holds on to that action and it forgets it's a different action. So by putting in needles or by stimulating acupressure points based on, we know that each segment has different information held in it based on the sun it gets and its position, we can then help the body remember its proper healing effects.
Okay.
And so I think that's the easiest way to explain when we do acupressure, is we're reinforming the body on certain types of information that it needs, that's
Okay.
forgotten that it needs.
Yeah. So that's what you're doing right now in the age
That's
of
what I'm,
COVID, when you've had to take your practice online. It's qigong
qigong. Yeah,
and also acupressure, which instead of using needles, you're using your own. You're pressing
exactly.
the points
You're,
yourself.
that's exactly it. Yeah,
Yeah. Okay.
yeah.
Is there
And the
anything?
qigong,
Yeah.
well, just the qigong some people might not know what the word qigong means. So you've probably seen Tai Chi or people doing very flowy movements in the. So Tai Chi is actually a
In
martial
the
art
parks, right?
in the parks, and yeah, lots of people do it. So Tai Chi is a martial art. So it actually
Hmm.
has a martial application. Qigong is a series of movements, but they're more based on how to move what we would call energy in the body without having a martial application. So they're much more curative and they're more internal. And it's about, if you want, we can do certain qigong movements to help respiratory problems, to help circulation problems, to help renal problems. So we can also look at what we're doing with the qigong to be specific as a curative approach. And then there's also these general forms that you can find that are all over the internet, which are very similar to the way that yoga is used.
Hmm. So interesting, because I feel like when you talk about it, I get the sense that it's also about moving energy through the body. And
It mhm,
maybe it's very simplified, but also in a way creating more space, creating more flow, more oxygen. Um,
it is, yeah. Well, when I think about qigong, one of the best definitions I've read is that it's actually about the movement of potential energy.
oh, okay.
So the qi is in Chinese medicine. It's a word that we can't really translate. The closest would be vital energy, but
Hmm.
it's much greater than that. And gong is the movement of,
Okay.
but it's actually this movement of the potential of the energy, because the energy itself is always moving, but you're taking its potential and you're focusing it to where you want that energy to actually manifest itself.
Hmm. Very interesting. Okay. Is there anything more that you'd like to share before you finish?
Well, I can talk for hours, but I think that's enough for 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 today. I think there was a lot in there for people to get, and yeah,
Okay. Well, thank you very much.
my pleasure. And thank you for having me on.
Thank you.